Chairman, I, Dr. Harvey Mbithi, having been nominated for appointment to serve as County Chief Officer, Human Health, Human Resource Management and Administration in the Department of Health Services, do swear that the information that I shall give before this select committee on health services shall be the truth, the whole truth, and nothing but the truth. So help me God. The facility itself, if you know you have healthcare workers who are on call, it is extremely important, and we don't have here in Machakos, we do not have a call room or a call center where health workers can sit when they're doing calls at night. So what happens here, for instance, the doctors that I've served, is when they're doing calls, they are forced to lock themselves in cars. If they don't lock themselves in cars, then they go home. So if I go home and then you call me, you tell me there's an accident in the hospital, then I will not use my car. I will tell you, bring the hospital utility vehicle to come and pick me, isn't it? So when the driver comes, and the driver takes about 1 hour by the time they get to go pick the staff, and then the staff also drags around at home by the time they come to the hospital, then Mheshimiwa, you will be seen at around 2-3 p.m. for about 10-15 minutes, and then you will be frustrated. So there's a system gap that really needs to be looked into. It is not just on the healthcare worker, even on the administrators. They need to know the turnaround time when a clinical officer is called. How long is that clinical officer supposed to respond by the time they see a patient? So we are supposed to keep a record. When was that clinical officer called? And when did that clinical officer get to see the patient? Then you will be able to tell where the fault is. So let me put the fault in the system. One, before I also blame the healthcare worker, because the healthcare worker has also a part to play. Yeah? So there is the system, there's the healthcare worker. It's an entire system that needs to be looked into and dealt with. Including in Machakos, what we did when I was negotiating with the government, we created a doctor's call center and a lounge. And what the doctor's call center has, it has beds and it has locker rooms, and it has a shower, a bed, and a TV, and even Wi-Fi. So when doctors have worked the entire day, they come here, they can change, wanaweza oga, they can even sleep within the hospital. So that when you are called, the turnaround time is between 5 minutes and 10 minutes at maximum. You get to the hospital. But if this officer is 40 kilometers away, some even 60 kilometers away, I can assure you the turnaround time will not be 10 minutes. It will be close to 3 hours, 4 hours. And this is where we have a system gap. These are the things that we really need to sit down and agree upon and resolve. Thank you.